Progress on a coronavirus vaccine and that one could be ready this year. If you choose to get a vaccine, you may even see a big difference in the form of a radio frequency ID chip. CBN medical reporter Lori Johnson explains why.
People who get a coronavirus vaccine may notice it looks a lot like their eye drops. They might also see an RFID chip on the package. The U.S. government has contracted Abiject Systems of America to make 100 million pre-filled syringes to quickly distribute a coronavirus vaccine. It would use a high-speed blow-fill-seal technology used in pre-filled single-use eye drops.
There are eyedropper facilities in the U.S., not many, but a few, that we are going to upgrade so they can handle vaccines. Then what will happen is those facilities will make the containers right here that will hold the vaccine. We will add a needle hub to them, and voila, you have a pre-filled syringe that's ready to use.
There's also space on each syringe for an optional radio frequency identification chip containing a unique serial number for each dose. It would not be injected or touch the patient. The chip would be scanned by healthcare workers in order to better track overall vaccine information.
It is designed so that there is no counterfeiting. It's designed so that we'll know exactly that the right dose hasn't expired. However, that chip only refers to the dose. There's no personal information, no patient information. It's simply like a barcode, only we know instantaneously where and when that dose has been used. That also helps public health officials know when there are outbreaks, have we vaccinated enough people in those areas?
The pre-filled syringes will add to the limited number of traditionally manufactured vaccine supplies, such as specialized equipment to fill glass jars, stoppers, needles, and syringes.
People are worried about, do we have enough medical glass to be able to put all of these doses of the vaccine into vials so that they can be administered? And that's a serious issue to think about right now, even as we are anticipating, if all goes well, that such vaccines may be available in millions of doses as soon as this fall.
The Department of Defense says once the vaccines are made, they'll be delivered to healthcare providers nationwide with the speed and efficiency of the U.S. military. Lori Johnson, CBN News.
Thanks, Lori. 100 million pre-filled syringes. Pretty creative and, Gordon, potentially life-saving technology.
Well, this is really good. Please watch out for what's going on the internet right now. And there's a lot of fake news about this, that somehow the government's trying to chip you. No, that RFID chip doesn't come anywhere near you. It doesn't get injected into you. What it's useful for is to let medical authorities know where the dose was administered and when the dose was administered. And it's also useful to making sure we're not seeing counterfeit vaccines come onto the market. So it's a way to make sure that the dose that you sign up for is the dose that you're actually getting. From a medical authority basis, it lets them know how many people were vaccinated in a geographic area. So if there is an outbreak, they can reliably say, you know, what's the effect of this and what's the potential infection rate. So please watch out what's happening on the internet, calling this, you know, the government trying to chip you or, you know, some, you know, radical conspiracy theory. It's not that. This is a good use of wonderful technology. Terry?
Well, up next, it's